name is Grace Hall, and today I'm going to talk to you about respiratory therapy and respiratory therapists, what they do, where they do it, and why is it so crucial. I can give you this example. Imagine somebody collapsing in front of you, unable to breathe. Okay, there's going to be a doctor, of course, there's going to be nurses rushing in. There's also going to be one crucial professional stepping in, and that's the respiratory therapist. The respiratory therapist's main job is maintaining the ability to breathe. Oxygen flow, ventilation, breathing. That's their main care, okay? In an emergency, life and death can be pending on a matter of seconds, okay? And that's very serious. And respiratory therapists can largely make that difference. Respiratory therapists are licensed healthcare professionals who specialize in cardiopulmonary care. Their main jobs could be described as setting up ventilators, airway management, advanced life support, and right then and there, oxygen care. They're on the go. They're right there. They know exactly what to do and how to help you breathe. They can be found in hospitals, ICUs, even patient transport. Anywhere that you find yourself in emergency, I can assure you there is a respiratory therapist on call and ready to go when you need them. According to the American Association for Respiratory Care in 2023, respiratory therapists are absolutely indispensable in an emergency. Now, that's a big statement, but just think, you need somebody to deal with your heart, your vitals, and you need somebody to make sure you can breathe. I mean, oxygen is literally life. So with even short delays are absolutely crucial. You go through your whole schooling of respiratory therapy to find out how to fix this, how to recognize it. They specialize in COPD patients. It's a very crucial role. They provide rapid intervention, which could be, when they hop off an ambulance and they find you as a first responder, can be used. I mean, they know exactly what to do. I commend them. But let's think about, why is the role so critical? Respiratory therapists being specialized knowledge that complements doctors and nurses, okay? Ensuring patients receive the care they need in the most urgent moments. Their actions directly impact survival, recovery, and overall patient safety. Today, I have explained who respiratory therapists are, what they do, and where you might find them. Respiratory therapy is easily overlooked as a job. While it's highly important, and I'm sure you're catching the grasp of just how important they are, think about it. Do you ever hear the word respiratory care? Respiratory therapy? Respiratory therapist? It's not a common word. I mean, you hear doctors, surgeons, nurses all the time. But as we grow and as the world is growing and medical needs are becoming more necessary, you're going to hear it a lot more. Next time you hear the words code blue, just know you are going to see a respiratory therapist right there too. They're there, they're on call, they're waiting right there with the doctors and nurses. They work hard. They work very hard. It's a very demanding job. It's a very rewarding job if you think about it. The ability to breathe is everything to the human body. They give you the ability to breathe. That's why they're so essential. So, thank you so much for listening. I hope I gave you a very informal outlook on what a respiratory therapist are, what they do, and now you'll know what to look for and who to look for in cases like I've described. Thank you so much.